Heart disease and stroke are a major cause of death worldwide, and in the UK, it's one of the most single biggest cause. And so 15% of men and 10% of women are affected. And the number of deaths from heart disease have been decreasing over the recent years, but it's still one of the major causes of premature death, so people before the age of 75. But it is a largely preventable disease through healthy diet, exercise, which we'll talk about later on. And the condition that causes most heart attacks and strokes are known as atherosclerosis. And atherosclerosis is the buildup of fatty material inside the arteries, and like the coronary arteries that supply the blood to the heart. And the buildup of the fatty material causes narrowing of the artery. And then as they become more severe, they can restrict the flow of blood. And if the fatty material breaks down or ruptures, a blood clot can form, and which can completely block the artery and leading to a heart attack. And strokes occur if such ruptures happen to blood vessels that lead to the brain. So I'm going to talk about risk factors. There's two types. There's modifiable and non-modifiable. So the modifiable ones are that can be managed, you can change it. So that includes smoking, high blood cholesterol, inactivity, so lack of physical activity, obesity, high blood pressure, and diabetes. And non-modifiable ones are that you can't really change, like hereditary family history, gender, ethnicity, and previous history of heart attacks and strokes, and also age. And so some preventions, so controlling your blood pressure and keeping your cholesterol and triglyceride levels low, because high blood cholesterol can clog up your arteries and raise your risk of coronary artery disease. And staying at a healthy weight, eating a healthy diet, and getting regular exercise. Limiting your alcohol intake and not smoking or reducing the amount of cigarettes you smoke, managing stress and managing diabetes are all major factors that can help prevent it or reduce your risks, and making sure you get enough sleep as well. And then I'm going to be talking about certain foods that have effect on the heart. So fish and oily fish, although there isn't enough evidence to recommend supplements or eating fish, but it is recommended to eat at least a portion of oily fish. And then saturated fat, which is too much of it can raise your cholesterol, and that increases your risk for heart disease. Trans fat, which are found partially hydrogenated vegetable oils, and is naturally in small amounts in meat and dairy products. And these have been shown to have an adverse effect on the blood cholesterol. So having more whole grain and high fiber foods, having minimal salt in your diet, fruits and vegetables, and plant sterols and stanols. So the cost of treating cardiovascular disease. The costs involved in treating patients for heart attack or stroke are substantial. And in the EU, the annual cost of cardiovascular conditions is estimated to be 210 billion euros. And of this cost, around 53% is due to healthcare costs, and 26% due to productivity losses. And the remaining 21% is made up of costs arising from time, effort given to informal carers, such as family members of patients. And then the bulk of the costs can be attributed to failing to recover from cardiovascular episodes, which leads to loss of money through premature death or due to decreased productivity. And the cost in loss of productivity is high. Patients require time off to recover from their surgery or illness, and this results in a diminished income for the patient as well as reduced productivity for the employers. And in order to tackle the impact of such diseases, it's imperative that the government takes a holistic view of healthcare taking into account the cost due to hospitalization and diagnosis. And then I'm going to talk about a bit of heart disease in India. And cardiovascular disease have become the leading cause of death mortality in India, and in comparison with the people of European ancestry, cardiovascular disease affects Indians at least a decade earlier and in their most productive midlife years. And for example, in the Western population, only 23% of cardiovascular deaths occur before the age of 70, whereas in India, this number is 52%. And in addition to case fatality attributable to cardiovascular in low-income countries, including India, appears to be much higher than in middle and high-income countries. And the World Health Organization has estimated that with the current burden of cardiovascular disease, India would lose $237 billion from the loss of productivity and spending on healthcare over a 10-year period. And the reasons for the high propensity to develop cardiovascular disease, the high case fatality and the high premature mortality include biological mechanisms, social determinants, and their interactions. And that's it. Thank you.